Welcome everyone to our Moving with MS virtual support group. This is something that we do every month. I am Dr. Gretchen Hawley, physical therapist and multiple sclerosis certified specialist, and I partner with MS Visa News to bring this monthly support group to you. And as I mentioned, I'm a physical therapist, so the majority of our topics that we have each month are in some way, shape, or form related to physical therapy for multiple sclerosis. And today we're going to be talking about analyzing your walking. I get really passionate about this topic because so many of my patients that I work with are working towards improving their walking. Like 99.9% of the patients that I work with are working towards that. But it's so important to break it down even further and understand what isn't great about your walking now and what specifically are you looking to improve. And as a physical therapist, it's my job to analyze your walking, but there's lots of ways that you can actually analyze your walking yourself at home. So that's what we're going to review today, and I'm hoping that you will understand a bit more, not just on how to analyze your walking, but also find the right solutions to help you walk better. So let me go ahead and pull up my slides and then we'll get started. And a huge shout out to our supporter, which is Viatris, who helps make this support group happen. Okay, we're going to be reviewing how to analyze your walking. So this is our outline for today. First and foremost, we're going to call out some of the most common gait abnormalities and requirements. We're going to do an analysis and discuss exercises that can help. And we're going to talk about other contributing factors. And by the way, this is a laid-back support group. If you guys have any questions or thoughts or comments, feel free to share those in the chat box, especially if you have found something that has helped. Your experience is invaluable, and we can use your tips and tricks to help other people on the call too. So don't feel shy about commenting in that chat box. And let's start off with a question. So my first question for you is, what is the number one thing wrong with your walking? And so I want you to think about what is the most challenging movement that impacts your walking. And if you can comment in the questions box or the chat box over on this side, let me know what that is, what comes to mind. And on the next slide, we have a few things that might prompt some more answers. But before we dive any deeper, I'm just curious if you had to pick the number one thing that's wrong with your walking. A lot of people might say, I can't walk as far as I want, like stamina, or quality, or tripping. So is there anything that comes to your mind? I'm going to look in the chat. A bunch more people saying hello. Let's see, I missed a bunch. Kathy says hello from Arizona. Deborah says hi from Minnesota. Felicia from Washington. Kenita from California. Julio from California. Deb from New Jersey. Julie from California. Lots of California people. Awesome. Okay. So we've got Deborah saying balance. So balance is the most challenging part when just standing and getting ready to walk. Yeah, absolutely. Julio also says balance. Deb says weakness in my foot or ankle and drop foot. Angela, my knees make me walk wobbly. Kathy says lifting the right thigh enough to compensate for foot drop. Yeah. I have extreme spasticity in my right leg that causes difficulty. Yeah, so spasticity. First, standing up, it takes me a while to feel stable. And that's Chris from Fort Lauderdale, welcome. Kenita, balancing on one foot as I step forward. Yeah, I'm challenged with my left leg, bending my knee and my hip swings. Yep. I use a rollator, but still have challenges. Yeah. That's the thing about mobility aids is oftentimes they are there to help, of course, but if you aren't additionally focusing on the right exercises, you'll still have the same struggles with walking. You're just also using a mobility aid. So we'll discuss that today too. Walking too slow, says Edith. Maurice from Georgia, welcome Maurice. Maurice has foot drop. Felicia says balance, stamina, quality, limping, balance, can no longer walk without holding on to something. Foot drop and knee hyperextension. Yes. Oh, these are such good answers. Hip hike. Yep. Rushing, feeling like I'm going to fall backwards. Balance and stamina from St. Louis, Missouri. Welcome. Okay, so all of these are great. And you heard me say several things multiple times, meaning it's not just you who's experiencing it. It's a lot of people who have difficulty with walking have similar components. So what I love about reading everything that you guys said out loud is that lots of people have the same difficulties, but also there's so many different things that are difficult. And that's the first step to analyze your walking, is to think about what specifically is it for me. Because if you go to your neurologist or if you go to your physical therapist and you say, I want to improve my walking, that is so broad. There's tons of exercises that can improve your walking, but I'm just going to call out a few of the things you guys said. If you have foot drop, that's different exercises than if you have spasticity, which someone else mentioned, which is different exercises than if it's balance or stamina or feeling like you're falling backwards. There's different exercises for each of those things. So it's really, really important to first, just basic question that you can answer is, what do you feel is wrong with your walking? So thank you for answering that. Okay, next, what is the number one goal for walking that you have? And this might be similar to the thing that you felt was wrong, but what is your goal? I'm going to leave a few moments of silence for you to think about that and type what your goal is. Because there's lots of different types of goals. All right. I don't want to fall down. That's a really good goal. To take steps seamlessly. I love that goal. You know, just have a smooth gait. To walk normal. Yeah. Walk without a rollator. That's a good one. Being able to walk safely. Yes. Strength with walking. Improve my ability to walk distances greater than a few hundred feet without resting. Yeah, so that stamina and endurance. Need to get my driver's license back. There you go. To walk without help. Walk without orthotic. Fitness for square dancing. I love that so much. Walk a longer distance before getting tired. Yes. I dream of being able to walk without getting stuck and having to use the rollator. Independence. To walk my daughter down the aisle unassisted. I love that, Michael. I've had many clients who have had daughters that are getting married and their goal is to walk their daughter down the aisle, and they were able to do so. So it is possible. Improve distance without needing to stop and rest. Yes, speed and fluidity. Awesome. So again, this is really, really important to think about, is what is your goal? So many people, if you don't think about this, even for 10 seconds, the goal is, I want to walk better. But as you can see, walking better can mean lots of different things. And again, there's different exercises that are more likely to help you reach that specific goal versus if you're just generally looking to improve your walking. So it's good to have these conversations and these thoughts before working with your PT and neurologist. Get back to walking normal, walk without fear of losing my balance. Yes, fear of falling is big. Okay. So there's lots of different gait abnormalities that are common in MS. We're going to talk about 7. And so what we're going to do is we're going to go through each of these 7 on the next 7 slides and discuss what the issue is and things that we might be able to do to help. But I'm curious, as you look at this list, is there anything that you know that you have? And I saw at least 1 or 2 people already mention hip hike, but just looking at this list, do you know if you have hip hike, hip drop, circumduction or hip swing, foot drop, foot slap, foot drag, or walking like you're drunk? Let me know in that chat. So yes, Dan says all of the above. That's a reasonable answer as well. All of the above. And the reason why we're going to talk about all of these is because we need to know, where's the issue here? Is the issue in the hip, the ankle? Is it balance? Is it all of the above? It's important to analyze these things because, again, the more specific we get, the more effective the exercises can be. Okay, I see Barbara says 1, 3, 4, and 6. All Roshan says all. 1, 5, 7, 4 and 7, walking like a duck, yeah. Number 7, walking like you're drunk. 5 and 7, 1, 3, 4, 6. Circumduction, knee, oh yeah, knee hyperextension. That's another one that's not on here, but we can definitely talk about all of them. 4, 5, 6. Yeah, okay. So we're gonna do a little bit of a demonstration. But before we do that for each of those, I want to discuss what walking requires, because again, so often people think walking requires strength and balance and maybe a little bit of flexibility. And that is true, but it also requires these 8 things. So it requires strength. You need to have enough strength in your muscles to pick up your leg and move it forward. It requires balance. You need to have enough balance so that as you're standing on one leg, with or without a mobility aid, you can stay standing and not fall over. And standing on one leg while bringing your other leg through. That's balance. It requires flexibility. As someone mentioned earlier, if you have really tight muscles and or spasticity, that's a lack of flexibility. So it's going to be hard to straighten your knee or bend your knee or lift your leg, not necessarily due to weakness, but because your muscles are so tight. So we need to have that flexibility to move fluidly. Range of motion. Range of motion is something that happens in the joints. So if your knee joint can bend or straighten fully, if your hip joint can bend or straighten fully or rotate around. Vision. If you can't see well, or if you have double vision, blurred vision, optic neuritis, any type of vision changes, that affects your walking. Sensation. If you have abnormal sensation in your feet, like numbness, tingling, burning, pins and needles, that's going to affect your walking. If you can't feel the ground and you don't know where your foot is going to land, that can affect your walking. Speed. Not too many people said walk faster, but speed is a different component than strength. So if you have a goal of improving how fast you can walk, even if it's just a little bit faster, that requires speed. Endurance. Several of you mentioned that you want to be able to walk further. That's endurance or stamina. Another thing that's not on this list is proprioception or kinesthesia, which is the ability to sense where your leg is in space without looking down. Meaning if you're looking at me and walking, will your foot land where you want it to, or is it going to cross over and make you trip, or is it going to fall out to the side? That's the walking like you're drunk component is more often than not a proprioception challenge. So walking requires lots of different things. And again, to get the most effective exercises, we got to break it down. And as some of you mentioned already, it might be all of these things, or it might be most of them, or just a few. So it's important to first address what's really going on. I see some people say foot slap, the knees falling in. Yeah, absolutely. How important is core strength to aid with walking? Core strength is very important. The core is our center area, our front, side, and back. And the more strength and stability we have in our core, the more the rest of our body can move more fluidly. So very important. Oops. There we go. Okay, so let's analyze this even further. So when we're thinking about strength, we want to look at strength in multiple areas. Strength in your hip, strength in your knee, strength in your ankle, and as Dion just asked, your core strength. So strength in your hip would be, can you lift your leg? Can you bring your knee up towards the ceiling? That's hip strength. Strength in your knee, can you bend your knee? Can you straighten your knee? Ankle would be lifting your ankle and lowering your ankle. Core would be tightening your core muscles. So we want to look, do you have strength or weakness in all of these areas, or 1 or 2 or 3? And if so, where's the biggest amount of weakness? And you could determine this on your own as well. We'll get to that in a second. Balance. We want to look at double balance, meaning both feet are on the ground. We want to look at single balance, meaning standing on one leg, because a big component of walking, 60% of walking, is when you are on one leg, with or without a mobility aid. 60% of walking, you have one leg on the ground as the other leg is moving forward. And then staggered stance. So when you're walking, more often than not, once you put that other leg down, you're now in a staggered stance. You're not standing with both feet side by side. One foot is forward and one foot is back. So we got to look at balance in those three positions. Flexibility, similar to strength. What is your flexibility like in your hips, in your knees, in your ankle? Because if you have tight muscles in any of those areas, it can inhibit your walking. Range of motion, same as flexibility and strength. Let's look at the range of motion in your hips, knees, and ankles. Okay, so let's get into some specifics. So the first is hip hike. And I'm actually going to stop sharing the slides for a second because I want to do a demonstration in case anyone doesn't know what hip hike is. Deborah says, I have found core strength is super important to correct mistakes when walking. Yep. Lori says, getting weaker all the time using walker hurts elbows. Oh, yeah, so let me write this down so remember to come back to this at the end. Elbow pain. I want to make a comment on that, but I don't want to get too off track. Elbow pain with walker. Okay. All right. So I want to first demonstrate for you what walking requires and hip hike. Okay. So as I was just discussing, walking and taking a single step forward and then the other leg forward, it requires a lot of different things. So walking requires that I shift my weight forward, that I bend my knee, that I bend my hip, that I lift my toes, that I straighten my knee. And all while I'm doing this, I'm standing on one leg. Even if I was using a mobility aid, I'm still standing on one leg. So you have to be able to have that balance. Then as I put my leg down, now I'm in that staggered stance. If I face you, you'll see I'm in this staggered stance balance. And then I move forward and do the same thing on the other side. So do I have the strength to put my body weight on this leg? If not, that might be an exercise you could do. Do I have the strength to bend my knee? If not, bending your knee is an exercise you could do, and so on and so forth. Then we think about flexibility. Do I have the flexibility to bend my knee? Or are my other muscles so tight that it's preventing me from bending my knee? Then balance. Can I stand on one leg? So that's what we're talking about when we're looking at the strength, the balance, flexibility, etc., of each individual joint, hip, knee, and ankle. So when we're talking about hip hike, what we're referring to is as you step forward, one hip hikes up. And I'm going to really exaggerate just so you can see. But as I'm walking, it hikes up, and then you put that leg down. Woo! And then you bring your other leg forward, and it hikes up. So it's this hike here. And you might know that you have this if you feel a lot of pain and tightness on this side of your core or even your low back, but just on one side, because you're doing this when you're walking. And the reason typically that happens, and we'll get to this more in a second, is because you can't bend your knee or you can't lift your ankle. So your body is saying, okay, what can I do to get this leg forward without like scuffing the ground? One thing I can do is lift my leg up like this, and now I can clear the ground and put it down. So that's what a hip hike is. Let me know in the comments if you now realize after seeing that, if you realize, oh, I think I do walk that way. So why does this happen? First, if you can't lift your leg, so if your hip flexors are weak, this can happen. If you can't bend your knee, or not necessarily can't, but if it's difficult for you to bend your knee, this can happen. If you can't lift your ankle, this can happen, as I just demonstrated. All three of those things, if you can't do any or all of those things, your brain still needs to find a way to get you to move your leg forward or both of your legs forward. And so one way that it does that is through the hip hike. So what can you do if you have hip hike? You can strengthen the marching exercise, which is bringing your knee up towards the ceiling. You can strengthen the bending of your knee, and you can stretch opposing muscles. Also, of course, practicing balance. If you can't stand on one leg long enough to bring the other leg through, it requires that the opposite leg move faster, because if you can't stand on one leg for a very long time, in order to get off of that leg to make you feel stable and put the other leg down, you've got to move fast, and that makes any symptom worse. So I want to demonstrate these for you. Let me see in the chat for a second. Would it be helpful to have someone video me so I can value my walking? I'm not sure I would be able to tell without a video. Absolutely. I absolutely love for anyone that I'm working with one-on-one, if it's virtual, to send me a video of their walking. And so what I would recommend you do, if you have someone that can do this for you, is have someone film you where you're walking. They're here with a phone and they're filming you walking away from them, turn around, and then walk towards them. And then also have them film you from this side where they can catch the side view of you walking away and then back. Those two different angles will allow you to see all of the things that we're talking about right now. So yes, good question. So before we move on, I just want to demonstrate so you can see, because these are going to be common in the other ones that we review. So with the hip hike, again, it's this hiking up. The reasons you do that is because you have a difficult time bringing your hip forward, a difficult time bending your knee, or a difficult time lifting your ankle up. So strengthening exercises for that could be practicing marching, which is this exercise, practicing bending your knee, and practicing, I like to do this one seated, practicing lifting your ankle, like that. Now, if any of those are too challenging, you can modify, and we have a whole support group presentation recording on modifying. So it would take a while to do that for each of those today, but definitely watch the past recordings, specifically the one on how to modify exercises. Okay, so that is hip hike. The next is hip drop. And actually, before I share my screen, let me just show you what hip drop is. And let me know in the chat if you think that you have hip drop. So we just reviewed hip hike. Hip drop is where your hip falls down and you bring your leg through and then it falls. So you kind of look like you've got this hip sway going on. So again, as you try to bring one leg through, it falls, through and falls. And it looks like this side is falling, but what's actually happening is weakness in this hip, because this hip is what's supposed to stay in so that this side doesn't fall. So that's what hip drop would look like, is this. Okay, let me know in the comments if you have hip drop, and then let's learn more about it. All right, so why does hip drop happen? Gluteal or outer hip weakness, not hip flexors. And I wanted to point this out because so often people assume that hips are really just the hip flexors, or that weakness in the hip flexors is what causes all walking abnormalities related to the hip. But in this case, it is not the hip flexors, it's the outer hip muscles. So what do? We want to strengthen those gluteal and outer hip muscles. I'm going to show you one of my favorite exercises, which is the seated clamshell. But the other option is to stretch the opposing muscles and then balancing on both sides. And one thing I forgot to mention, let me actually go back a slide, is the stretch opposing muscles. One thing that's important and that you'll see for each of the things we're discussing is to strengthen the appropriate muscles, stretch the appropriate muscles, and balance. Those three things should be what you include in your exercise routine to have a well-rounded approach, so that you're not just focusing, if we go back here, we don't just want to focus on strength or just balance or just flexibility. This approach allows you to focus on these three things for each of these symptoms, if you will. So let's go back to hip drop. I actually forgot to show you the stretches for hip hiking, so let's do those first. So the reason hip hike that we said that would happen was, let me stand, weakness here or tightness in the opposing muscles, which are the muscles on the back. So if you're weak in the front and tight on the back, that's going to make this movement hard. So you'd want to work on stretching the hamstrings. One of my favorite hamstring stretches is this stretch here. We're covering a lot today, so please know you have the recording. So if you need to see anything slowed down, you can watch the recording and get that. So this is one of my favorite stretches for the hamstring stretch. Another thing we mentioned was weakness here, but another thing that makes bending your knee hard is tightness on the quad muscles, the front of your thigh. So stretching your hip flexors and your quads, this is one way that you can do it, is a way that you can stretch the muscles in the front to allow you to bend your knee better. And then lastly, we had said if lifting your ankle is difficult, you might have hip hike or foot drop. We'll talk about this in a second. So you can strengthen your ankle like this or stretch the back side. So strengthen the front with this exercise or stretch the back with a calf stretch. And you could use a cane or a belt or something to pull your toes towards you and hinge forward, and you'd feel a stretch in the back. So when you're thinking about strengthening, you want to strengthen certain muscles, but then stretch the opposite muscles. And by opposite, most of the time, it's the muscles on the other side. So if you're trying to strengthen the front of your leg, you'd stretch the back of your leg, if that makes sense. The exercise I want to show you for hip drop is the seated clamshell. And so what that looks like is you're sitting, not in a wheeled chair. I'm only sitting here because that's the chair I have in my office right now. But you want to sit up tall and tighten your core. Core, as we've discussed, is very important. And you're going to open your knees as wide as you can go without your feet coming apart. And then close your knees. And then open them wide, wide, wide. Squeeze your bottom, squeeze your butt cheeks if you can. Then relax and close. And open and squeeze. So this is the strengthening exercise for the outer hip muscles to stretch the opposite muscles. If we were in class right now, I'd wait for you to tell me what's the opposite. So the opposite of our outer hip muscles are the inner hip muscles. So one of my favorite exercises to stretch the inner muscles is this. And you're pushing your knees out as you're leaning forward. There's lots of stretches and lots of strengthening exercises for each of these. I'm just showing you one of my favorites for each. So hip hike, we want to, hip drop, we're strengthening the outside and stretching the inside. Okay. Let me know if you have any questions on that one before we move on. I see someone says, I can't do any of those. Yeah, there's lots of ways to modify. Again, today's focus is mostly evaluating and analyzing your walking so that you know what's going on. And then, of course, we're briefly touching on some solutions and exercises. But let me see if I can take a second here to actually find the recording that we have on how to modify. All the exercises that I demonstrate in standing can be done seated. They can also be done lying on your side, like if you were in bed or on a couch. They can also be done lying on your back or your stomach or in any position that you can do them in. Let me quickly pull this up and see. Let me know if you have any questions so far in the chat as I'm looking this up. All right. How to modify, here we go.
Hello?
Copy, okay. I'm gonna share this in the chat with you guys. Okay, and we are actually, if you're interested in this topic, send to all, there we go. If you're interested in this topic on how to modify, next month in September is when we're gonna be taking a deep dive into how to modify exercises. So tune in, I believe it's September 9th. And Marie says, how do I access the recordings? The link that I just sent you, well, actually, I can send you another link too. The link that I'm now sending you is the link to all of the recordings that we've had. Okay. You're welcome. So next is circumduction or hip swinging. And I'll demonstrate this in a second, but first let's talk about why this happens. So it's basically when you swing your leg around to the side as you're walking. The most common reasons this is challenging is because you have difficulty bending your knee, you can't lift your leg, or you have difficulty bending your leg, which is your hip flexors, and or you can't lift your ankle. So if you look at the hip hike, it's basically the same reasons, and everyone's body just compensates differently. For some people, hip hiking is going to feel easier than hip circumduction or hip swinging. For other people, this will feel easier, but it's the same reason. It's the difficulty of bending your knee, difficulty lifting your leg, or difficulty lifting your ankle. So therefore, the exercises are going to be the same for hip hike as it is for hip swinging, because the goal is to be able to bend your knee better by strengthening and stretching muscles, by lifting your leg better by strengthening and stretching muscles, and lifting your ankle better by strengthening and stretching muscles. And then we can't forget about balance. The more we practice balance, the more time it gives us. So I'm going to stop sharing and we'll demonstrate this. Okay, so for hip circumduction, I'm going to stick with this leg. So for hip circumduction, if you have difficulty bending your knee, lifting your ankle, or bringing your leg up, lifting your leg up, what you might find yourself doing, and I'm really exaggerating, but is swinging your leg around, swinging like this, swing. And again, the reason for that is because your brain is trying to find a way for you to get your leg forward without scuffing your foot on the ground the whole way. So your brain says, how do we do that? And it might say, oh, easy, just put your leg out to the side and now you're not touching the ground. So that's why that happens. So to recap, it'd be the same exercises as the hip hike. So if you think the reason it's happening is because bending your knee is really hard, then you can practice bending your knee in a standing position. You could practice it seated like this. You could practice it lying on your side, bending. There's lots of different ways that you can practice it. And if you have zero movement when trying it, still practice it. That's still an exercise that you should do. So that's to bend your knee, but you also need to stretch the opposite. So we're trying to strengthen this part to bend our knee, stretch the other side. So as I mentioned earlier, this is one of my favorite stretches, to stretch this front side. When this is flexible, it allows you to bend your knee a bit more. If you have difficulty with this, then this can be an exercise that you practice, lifting one leg up. If we're trying to strengthen the front, we want to stretch the back. So the stretching is this, to stretch the back side. And then the ankle, we've reviewed this too. If we want to strengthen the front of the ankle to lift, we then want to stretch the back. And again, use something around your ankle to pull and stretch the back. Now, one thing I didn't demonstrate earlier, I just verbally said, was balance. So I need let me back up. If I have difficulty bending this knee or lifting the leg or lifting the ankle and it's harder to get this leg forward, I'm going to need balance on this leg. If this leg cannot withstand my body weight or balance long enough for me to get this leg through, then I'm going to have to more quickly put my leg down because I can't balance on this leg. So my brain says, whoa, put your leg down. And the quicker you have to put your leg down, the less time you have to bend your knee or lift your leg. And it just makes everything worse, more likely than not. So practicing balance on this leg. And this is balance. Right now I've got about 95% of my weight on this leg, only 5% here. And I'm just trying to get comfortable with most of my weight on this leg. If that's easy, lift this leg off the ground. And of course, you can use a mobility aid, a rollator, a cane, any mobility aid at all while you're practicing balancing on one leg. I see a question, how often to do these? It depends what else you're doing for your exercises. If these are the only exercises that you're doing, then I would do these 5 days a week. And the 2 days that you take off be separate. So I wouldn't do like Saturday, Sunday as your off days. I would maybe Saturday, but then Tuesday is an off day. So you spread your off days apart. I did not receive the link for the past recordings. So I will paste that again. Paste. I just sent it to everyone again. See if you can look in it should be in the same area that you're typing. It should be where you're seeing my comment. Foot unaffected leg turns out makes it difficult to lift the knee. Yeah. So lifting the knee is that hip flexor. I can bend my knee, lift my leg, and lift my ankle. I still do circumduction. How do I train my brain? Oh, I love this question. How do I train my brain to concentrate and not rely on circumduction? Okay, so we still got a bit to go through, but I can answer this pretty quickly. So right now, thus far in our talk today, we're talking mostly about exercises that you can do, strengthening, stretches, balance, etc. But that's just a component of it. So we need to have the strength and the flexibility and balance, but we also need to practice it as one full movement. Otherwise, what you might find is you might be in a position like Julio where he can lift his leg, he can bend his knee, he can lift his ankle. That's fine. He's got the strength and flexibility and balance to do that, but he's still walking with one of these conditions. It could be because your brain doesn't have the same carryover as someone without MS, meaning even though you have strength, your brain doesn't understand that you want to use that strength when you're walking. So practicing that, I like to do it in a way called exaggerated walking. I'm going to write that down so I remember to show you guys at the end. Exaggerate walking. Okay, because we've got one more of these, or no, two more, and then I'll show you that one. But I'm glad you brought that up. Knee kissing, yeah, when your knees collapse inward, that could, a great exercise for that could be the clamshell one that I demonstrated earlier. How do I exercise the ankle to correct foot from going to the left? I'd have to know which foot and when that's happening. I just got a pair of Cadence sneakers. Should I be practicing step, heel, toe with these shoes? So we're going to talk about Cadence sneakers in a bit here. So let me know in the comments if you have foot drop, foot slap, or foot drag. Most of you guys probably know this symptom as foot drop or even drop foot, but there's other variations, and the other variations are foot slap and foot drag. Essentially, this is anytime your ankle or foot doesn't do what you want it to do. It either lands too quickly or your toe is scuffing the ground. You might even notice that you wear down one shoe more than the other shoe because your foot touches the ground more. I see someone says foot drop, yeah. Oh, someone says if you tap the box, it opens YouTube, even though the link doesn't show up. Oh, that's good to know. Thank you, Kathy. Left foot affected. So if the left foot turns out, so generally speaking, if one foot is turning out, the exercise would be to turn it in, so to pull it in as an exercise. Foot drop, drop foot, foot slap. Yeah, this is a pretty common one. And so the reason is due to weak ankle, which is the ankle dorsiflexor. So that's been the exercise that I've been demonstrating to you, where we want to strengthen the front of the ankle. So this strengthening the front is practicing lifting the foot up and then down, and then stretching the backside. So stretching the calf muscle, where you have the leg in front of you, you put the strap or belt or something around your ankle and pull towards you. So foot drop is more so when your foot, you don't have enough ankle strength to lift your foot. And so you might find that you are scuffing your toes more. Foot slap is when you can hear yourself walking, because your foot just kind of slaps down. You don't have the control to lower it down. And then foot drag is what it sounds like, where you're kind of dragging one foot because you can't lift the ankle. And again, practicing balance is going to allow you to have more time to lift your ankle. Let's see, I see someone says, I have foot drop. My PT recommended a new brace to provide me with more support when I walk and provide space for my leg to move. Yeah, so we're going to talk about braces in a second. What exercises do you do to make the foot turn in? So there's, it's very individualized, but generally speaking, if your foot is out more, it depends why your foot is turning out. Your foot might be turning out because you don't have great balance. So to prevent your foot from turning out, you actually would do a balance exercise. Or it might be due to tightness on the muscles on the outside of your lower leg. So you'd want to stretch the muscles on the outside. Or it could be due to weakness on the inside. So you'd want to strengthen pulling your foot in. So if your foot's normally out, you'd pull your foot in to strengthen it. So for every thing that happens, we have to look at the why. Is it due to a tightness? Is it due to a weakness? Is it due to poor balance? And then approach it with each of those components based on what's actually happening. How do you increase range of motion on your ankle? I have a cyanic sleeve that isn't 100% effective because of range of motion. Range of motion is how do I want to phrase this? The term range of motion refers to a joint. So the ability of your joint to move in the way that it should. So the best way to improve range of motion is by manual therapy, which you could attempt to do on your own, where in this case, you could grab your foot and roll it around. Grab your foot and push it up or pull it down. So you are manually trying to move the ankle. It's not necessarily a strength thing or a flexibility thing, it's a joint thing. So we want to move it around, or go to an in-person physical therapist that can move it for you. Okay, so we discussed foot slap. So lots of you said walking like you're drunk. So there's a few different reasons this might happen. So it could be an unstable gait, maybe due to balance. It could be a wobbly gait, also due to balance. It could be a scissor gait. So scissor gait, and I'll demonstrate this in a second, is when your feet come too close to one another, almost like you're walking on a tightrope. And why does this happen? Oftentimes you don't have enough balance on one leg, as we've discussed. So if you don't have enough balance on one leg, you don't have enough time to put this leg where you want it to, and it just lands wherever it can. Number two, poor proprioception, meaning you don't know where your leg is in space. So you want to put it forward, but you end up putting it out here or over this way. So let me demonstrate that for you. And then practicing balance and foot placement, which I'll also demonstrate. So the walking like you're drunk typically looks something like this, where as you're walking, you're just kind of walking and it looks a little bit wobbly or unsteady, and one foot might be going out to the side, and then this goes this way out to this side. And more often than not, it's due to balance. If you don't have enough time on this leg to slowly put your leg where you want it to go, and then you don't have enough balance on this leg to allow this side to go where you want it to go, your brain's going to say, put your leg down as fast as you can. Wherever it lands is fine with me. Just put that leg down. Otherwise, we're going to fall. So that's when you get the walking kind of like this, because your brain just wants you to get the leg down. So the solution for that often is practicing balancing on one leg. You would work up to that. So as you can see right now, I've still got weight on this leg, but majority of my weight is on this side. And you balance here. And then of course you practice the same thing on the other side. Once that gets easier, then you can get that leg off the ground and just kind of tap it when you need to. The other thing, the other way walking like you're drunk could look is scissor gait. Whereas when I'm exaggerating, but it's when you cross in front of the other leg. And this can be really dangerous because if you're crossing in front, then as you go to bring this leg forward, you could hit yourself and fall. So this scissor gait often can also be due to not enough balance on one side or not having that ability to tell where your foot is in space. Like you meant to put your foot here and you had balance in order to do that, but it landed here instead. So that's more of a foot placement issue. And one of my favorite exercises for that is to find something on the floor. I'm fortunate to have this colored carpet. So I'm going to, let's see, I have an orange dot right here. So I'm going to practice lifting my leg and placing my heel on the orange dot and then back. So I'm practicing placing my foot exactly where I want it to go. And if I face you, you'll see it's in front of this leg. I'm not going to choose a spot that's over here. I'm going to choose a spot that's in front of this leg. And you're practicing putting the heel on that spot. So if you have, a lot of you said the walking like you're drunk issues, those two solutions, the practicing the balance and practicing foot placement, is what I have found to be most effective for the patients that I work with. Let's see. While sidestepping, I have pain and soreness in my inner thigh. What can I do about it? It depends why. Every good physical therapist that you work with should never just jump into giving you exercises because it depends why. And if you don't know why, the wrong exercises might make your pain feel even worse. And so in this case and all cases, it depends why. If the why is due to tightness in your inner thigh muscles, then the solution could be stretching the inner thigh muscles or massaging the inner thigh muscles. But if it's due to weakness in the outer hip, maybe you'd strengthen your outer hip muscles. So it really depends on the why. And if you don't know why, I would definitely recommend seeing an in-person PT who can evaluate what's going on. There's so many different walking abnormalities, and this conversation that we're having in the chat is amazing because you guys are pointing out way more than what's on this presentation. There's so many things. This is just a brief overview talking about the most common ones, but everything you're saying is valid. There's so many different ways that walking can be affected, like for anyone saying that their foot goes out, or if you have ankle rolling, that's another one. So there's lots of ways that that walking can be limited or changed from MS, and analyzing your walking is the way to differentiate what's happening from something else. Okay, so other contributing factors, sensation, as I mentioned before. If you can't feel your feet, then you're not going to be able to feel the ground. And if you can't feel the ground, your brain's not getting the messages it needs to in order to help you walk. And so feeling the ground is a really important component of being able to walk. And so I'll share something with you about that on the next slide. Speed is going to be important. If you want to be able to walk faster, then doing exercises at a faster speed is what's required, not just slow and controlled, but also faster. Endurance. So if you have a goal of taking a few extra steps or a few extra feet or a mile or whatever longer than what you can now, then you need to slowly work on endurance type training. So that might be something like with each of these exercises we demonstrated today, instead of doing 10 repetitions, try to do 12. So slowly work your way towards doing more and using that muscle over a longer period of time so that it then can carry over to your walking. So other contributing factors, heat and cold intolerance. If you notice that your walking is worse when it's hot out, or when you're stressed, or after a hot shower, it's likely due to heat intolerance. So we want to take action to cool our core temperature down. Or if your walking is worse in the cold, maybe you have more spastic muscles in the cold, it could be due to being intolerant to the cold. So warming your core temperature, sipping warm water, wearing more clothes, bundling up, doing some exercise to increase your core temperature could be a strategy. Fatigue. If you're fatigued and that's what's causing your muscles to not work as well, rest is what we should be doing, not just strengthening and stretching and balance, but rest. Pain. If you're having pain and that's what's causing your walking to be limited, we need to address the pain. If you have other injuries or comorbidities, we need to address those. So it's not always just weakness or poor flexibility or poor balance or poor vision. It can often be some other things that are going on, and the best approach is to address what's going on and what the issue is. More likely than not, it's lots of things, but let's start first with just analyzing what are all the things and then prioritize from there. Okay, so helpful tools. AFOs, someone earlier mentioned braces. So AFOs, or ankle foot orthosis, is a brace that can help prevent drop foot. I believe it was actually last month that we had, if you go to the link that I shared with all of the past recordings, we reviewed all of my favorite products. All of these are on there, but AFOs prevent your foot from dropping. So that's something that might be helpful for your walking. Braces, ankle braces. So these actually work to reduce foot drop by assisting your ankle lifting. So that could be something else that you consider. For sensation, if any time that I said, if you can't feel the ground, if that resonated with you, one of my favorite companies is Naboso. They are a sensory-based company that have shoe insoles and other products too, but I love their insoles that you put into your shoes, and they have this material on them where it's little pyramids. It kind of feels like Braille for your feet, and as your feet touches it, it activates a part of your brain that is sensing the ground underneath you. So that can help with sensation. For shoes, there's two different shoes. Kizik shoes are basically hands-free shoes that you can just slide into. And so if you have poor balance or poor hand strength and tying shoes is hard, Kizik can be a really great option. Then there's also Cadence shoes, which actually have pucks on the bottom of the shoe that allow you to slide your foot forward. Now, if you have Cadence shoes, they are great shoes that can help you keep your foot on the ground and slide forward, but you should definitely do strengthening exercises in addition to wearing them. If you only use the shoe, it is possible that your walking will not improve because you're not working on strengthening the muscles you need to walk. Let me scroll back up to see the specific questions. I know someone asked about Cadence shoes. Where did it go? I just got a pair of Cadence sneakers. Should I be practicing to step the heel to toe. Yeah, so with the cadence shoes, you still want to practice bending your knee, lifting your leg, lifting your ankle, and then exaggerated walking, which I'm about to demonstrate. And then lastly, mobility aids. Mobility aids are a great way to help you improve your walking. But as someone mentioned earlier, they can cause elbow pain and shoulder pain and neck pain and wrist pain, hand pain, if you're putting too much weight through them. So it's always best to use the mobility aid as lightly as possible. So if you're putting a lot of weight through your upper body and through the mobility aid, you're more likely to cause pain in any of those areas. So work on using the mobility aid while you're exercising, but only as much as you need to and not any more. If you've been using a mobility aid for a long time and you're used to putting a lot of weight through it, then it's not too late to make changes. But what you should do is practice putting less weight through it. So if I were to ask you, when you're walking, how much body weight are you putting through the mobility aid? If you would say 80%, like heavy, then my first goal for you would be to maybe only put 60% or 70% or 75% of your body weight through it. So practice taking weight off of it as you're doing your exercises or as you're walking. And that's an exercise in itself, is practicing walking with less weight through it. Okay. This is the final slide in case you're looking to find even more exercises or other ways to reach me. We've got my email, missinglink.com is all the ways to work with me, different courses, my podcast, Instagram, YouTube, Facebook, and one that is not on here yet because I ran out of room is my book, which is called The Missing Link. So lots of different ways. I just want to show you exaggerated walking because someone mentioned earlier they have enough strength and balance in all the areas, but it's still, they still have hip hike or hip circumduction. So we've got to break it down into these components that we've just done over the last hour. In addition to that, you then want to implement that into your walking, meaning when you're walking, again, with or without a mobility aid, you should be thinking about utilizing those exercises that we just talked about. So as you go to walk forward, bend your knee, lift your ankle, lift your knee, straighten it, and put your heel down. And what you're hopefully thinking right now is, I could never do that, or I could never lift that high. That's the point. The goal is to exaggerate your walking as much as possible, putting in 100% effort into each of those movements. And it's going to feel silly, but you should practice walking. Let me back up. So you'd practice walking like this. And it's not going to look like this, but practice walking with as much bending and lifting and straightening. And that is when you're telling your brain that you want to use these movements while you're walking. You don't just want to use these movements to get strength, you want to use these while you're walking. And you know that logically, but your brain and its neural connections don't know that unless you practice it, unless you put it together. So as you're practicing lots of steps of walking, whether it's 5 steps, 10 steps, 100 steps, practice big movement as you're walking and putting all those exercises together. Okay, we went a little over. Those are all of my slides, but I will see if anyone has any other questions. So if you do need to go, thank you for tuning in. Does cadence sneakers work if you use a brace? You can use like an AFO or an ankle brace with cadence shoes, yes. Thank you for a wonderful and informative session or presentation. You're welcome. You're welcome. As you can probably tell, this analyzing your walking is so in-depth, and if we truly went through all of the different possible limitations, it would probably take 5 hours, probably more than that actually. But hopefully this gives you a good idea of what questions to be asking yourself, what things to tell the providers and healthcare professionals that you're working with, like your goals and what specific things are hard for you to do, and they can analyze for you and help you figure it out. But also if you don't have someone like that, hopefully you feel a little bit more prepared to assess what's going on at your hip, at your knee, at your ankle, and what can you do for each of those things. Cadence with Psionic. Yep, I imagine you could use the Cadence shoes with the Psionic knurl sleeve. Is exaggerated walking in the pool beneficial? Absolutely. Or does it just make me a better water walker? All exercises in the pool are so helpful because typically exercising in the pool is easier because of buoyancy. So if you can exercise in the pool, get stronger there, and then also, and this is where most people where they fall short, is they only exercise in the pool. You want to make sure you're also exercising on land, is what we call it. If you only exercise in the pool, then it is likely that you'll be a better water walker and not land walker. You want to be able to practice both in the pool and on land, if possible. Please show title page. Okay, I think that's what you were referring to as the title page. All right, well, I won't keep you any longer. Thank you so much for tuning in, especially with this newer time. I think this is now the third time we've done a 4 p.m. Call, but it did used to be at 7. So thanks for tuning in earlier, and I'm excited to see you in September. Have a great rest of your week. Bye, everyone.